were never meant to survive, sent me into lung failure. I was just there to grow this human, ventilated for 4 months, my bowel being outside of my body. You cannot physically stop me seeing my child. No one cared about my well-being, and I feel like things are tearing as baby's growing. Gastroschisis, meconium aspiration, placenta previa, Crohn's disease, bronchopulmonary dysplasia. My lungs only function at 40%, and the contents of your bowel is leaking into your abdomen. 5 abdominal scars. I've got a bowel obstruction because your placenta's ruptured. Everything was just shutting down. Like, I'm gonna die. I've never felt fear like that. I will rip out every cannula and every line, and I will make my own way there.
This podcast contains discussions and visual references to serious health conditions and medical experiences, including gastroschisis, babies in neonatal intensive care, and related topics. It also includes graphic medical imagery that may be distressing for some viewers. Welcome to the Silent Struggle podcast with me, Michelle Chan. Today's episode is one that's really going to stick with you. My guest Elle has been through so much, more than anyone ever should. Elle was born with a condition called gastroschisis and spent her first 6 months of her life on life support. That battle left lasting complications, including Crohn's disease, COPD, and more. Years later, her fight continued when her baby suffered from meconium aspiration syndrome, alongside further complications. From a tough start at birth to years of being dismissed by doctors, to a traumatic pregnancy and birth that could have been completely avoided if she was listened to. It's heartbreaking, frustrating, and honestly something that a new mother shouldn't have to go through. But she's here to share her story, not just to talk about what she's been through. It's to make sure other people don't go through the same and feel seen. This conversation is about speaking up, fighting for better care, and make sure patients are actually heard. So let's get into it. Before we start, I want to thank everyone for listening to this podcast. It means so much to me. So I've got a favour to ask. Can you please hit the subscribe button? I don't have a production team, so it's only me working tirelessly behind this. It would really help me to continue to bring more episodes of Silent Struggles to you. So if you can hit the subscribe button, that would mean the world to me. Let's get started. Welcome and thank you for joining us today, Elle. And congratulations on your pregnancy. How far along are you?
I'm 26 weeks and 4 days.
Oh, wow. So with everything you've been through, it must be really scary, isn't it?
It is absolutely terrifying, but I'm under a very, very, very good medical team. So it's been, I've had a lot of appointments, a lot of check-ins, and I feel very looked after.
I must say your condition is one of a kind, and because it's all started when you're in the womb. So let's start from the beginning. Can you tell me a little bit about yourself when you're still in your mother's womb? So all the conditions you've been struggling with your birth.
So at my mum's 12-week scan, I was diagnosed with a condition called gastroschisis. So the gastroschisis is a medical term which is defined as the bowel, small and large bowel, or either or, depending on how severe it is, growing outside of the body. So where the umbilical cord would be and that closure would be, my umbilical cord was wrapped around my bowel and my abdomen never fully closed in the womb. And as I grew, as you do grow inside your mother's womb, my bowel continued to grow outside of my abdomen. And there's nothing they can do in utero to repair that. It is only a repair after birth. So my mum had an amnio at 16 weeks to check if there was any other chromosomal or genetic deformities. That all come back negative. So it was just my bowel being outside of my body. And a plan was put in place that after delivery, everything would be put back in and I'd be okay. But upon my birth, I'd aspirated meconium as well. So that sent me into lung failure. So my lungs didn't function. Meconium aspiration, that is when, in effect, you poo inside of your mother's womb and you swallow it. And as anyone that is a parent will know, that first poo that a baby does, it's black, it's thick, it's like tar. It's not like the normal subsequent poos that babies do. It's very, very different. And it stuck to my lungs, which meant they then couldn't expand. So normal room air, I was then unable to breathe, which meant I needed a lot of mechanical interventions and ventilation to do my breathing for me because I was unable to do that myself. So I was born at 36 weeks, weighing £4, 4 ounces, with the majority of my small and large bowel protruding from my abdomen. Because my lungs then weren't working, it wasn't safe and I wasn't the correct size to put everything back straight away. So I had like a gravity bag, which was hung on top of my body. And as I grew bigger over the subsequent weeks, my bowel gradually went back in as much as it could. And then at 2.5 weeks old, I had surgery to put the remainder in and have a closure. But my lungs were still not functioning effectively. And I was ventilated for 4 months and then gradually weaned off the ventilation onto CPAP and then room air. At 6 months, I went home and I went home on nebulizers.
And all that was like 6 months?
Yeah, so I was in hospital for 6 months and then I went home on nebulizers, like inhaler type like medications for until I was 2. And I had
Oh, wow.
regular check-ins with a surgical team again until I was 2, 3 years old, because obviously I needed to grow. I needed to make sure I was absorbing correctly. I've looked at my records. I've always had a small stature, and it was always a question as how I would develop, how I would, if I'd ever become malnourished because of how my bowel absorbs. There was never really a question of my bowel that physically becoming twisted or anything like that. It was always a wait and see until she gets older and find out then. As a child, I had no issues. All of my issues began to occur as I got older.
When you was growing, how did you cope with everything?
So as a child, I just knew I didn't have a belly button. I had a scar,
Oh,
and that scar is the reason that I'm alive. And I knew that, like, I've got a scar on my neck, I've got scars on my chest. I'm difficult to cannulate. So if I ever needed bloods done as a child, I would always used to hear my mum say that I'd had a lot of blood transfusions and needles as a baby, so my veins are very, very poor. So I always knew how to defend myself growing up with doctors and nurses. So when I became an adult and I started to have a lot of bowel problems, I knew the script to say to doctors to explain about my medical history. My mum trained me very highly on, you do not have a normal anatomy, you were never meant to survive, and don't ever feel like you have to pay for being alive. You know, you deserve to have this life, you deserve to be listened to. And that's kind of the mantra I've always gone with. So when I was 25,
mhm.
I started bleeding when I was going to the toilet and having loads of pain and discomfort. And I had lots of investigations, and they diagnosed me with Crohn's disease, which is inflammation and ulceration of the bowel.
Oh.
And it's a lifelong condition. There's no cures. You can only monitor it and manage it with medication. And I was medicated for this. And they looked at doing surgery to remove part of my bowel. And when I met with a surgeon, he sat me down and said, there's nothing actually like medically wrong. He goes, it's a physical issue. And I said, well, what does that mean? He said, well, your bowel's back to front and it's twisted. Did you not know that? And I said, no. I said, I've had MRI, CT, X-ray, cameras shoved everywhere. How has this never been mentioned? How has it never been seen? And he says, it has been seen. He goes, but because they weren't looking for a physical issue, they were looking for a diagnosis of a condition as such, like something they can fix with medication. They never thought that the malrotation of the bowel, so my bowel being the wrong way, could have been causing these problems. So they ineffectively medicated me for the best part of a year when I didn't need it.
So, did you have operation on your
Yeah, so I had a
bowels?
surgery in 2019
And you
to
were how
try
old?
and I was 27.
Okay, so you start bleeding at 25, and after two
Yeah,
years, you had the surgery.
yeah. So I was admitted numerous times within that with bleeding, constipation, bowel obstructions, etc. And they were only ever looking at a disease and not at a structural overall issue. So it took 2 years to then get looked at properly. And then I went for surgery in April of 2019, and they tried to do a keyhole surgery to release what's called adhesions, and they are bands of scar tissue. And these adhesions had like grown around loops of bowel and had constricted them and become tighter. So at sections of bowel, the food couldn't get through. And obviously, as it's trying, it's becoming more inflamed and more irritated.
Wow.
So the idea of the surgery was to release those adhesions. And then I had what's called a volvulus. So it's like loops of bowel that had become twisted amongst each other and knotted. The idea was to try and release some of those knots. The surgeon went in keyhole when he probably shouldn't have done, and then cut straight through a section of bowel. And at that point, he then had to open my original scar by 4 inches and convert from a laparoscopic, so keyhole procedure, to a laparotomy, which is an open procedure, to then do the repair and try and free up more pieces of bowel. So I was in theatre for 5.5 hours, and my recovery took around 3.5 weeks. And I was left with 5 abdominal scars from that, because I had my keyhole scars, a drainage port, and then the middle one, which they'd reopened.
Wow. All that at 27, 28 years old?
Yeah.
Wow. After that, what happened?
I was okay. I was actually in a really good way. And then I was with my husband, we decided to start planning a family. And I
Wow.
remember my mum used to ask doctors what would happen when she goes to have children. And it was always we will never know until that time comes. It's an experiment, it's a wait and see, it's sort of a guinea pig situation. And at the beginning of my pregnancy, I met with my midwife, your 8-week booking appointment, and I explained about my medical history. And she said, right, you're going to be high risk. We need to get you under maternal med and make sure that you have correct consultants in place. I'd explained that I'd had the misdiagnosis. I do have a bowel malrotation, and it could then cause issues with a pregnancy. My whole pregnancy lasted 33 weeks. And in that time, I did not see one bowel surgeon or general surgeon to look at the condition of my bowel, even though from 24 weeks, I expressed to my maternal medicine consultant that I felt like my insides were on fire and they were burning. And I said, I feel like my scar tissue my adhesions and my external scar tissue aren't coping. And I feel like things are tearing as baby's growing. And I was told, first time pregnancy, it's all in my head. And it was really,
Wow.
really dismissive, because I've already been let down previously when I was misdiagnosed. So, and my mum used to say, you're your own advocate, blah, de blah. And I didn't know how to advocate for myself because I'd never been pregnant before. So I didn't know what was normal and what wasn't. But I had bowel obstruction, so I knew that wasn't normal. And I knew the symptoms I was feeling in relation to my abdomen were not normal. But it was getting listened to. That was a real struggle. And I saw 8 consultants in the space of 33 weeks of pregnancy, and everyone had a different opinion on
Wow.
how to manage my case. And I think that lack of consistency led to a lot of the subsequent problems that I had in delivery. So I had placenta previa, which is where your placenta lies on top of your cervix. So in fact, it blocks baby's exit. So I knew I'd have to have a planned cesarean if my placenta doesn't move. And I was very strong in the sense of, if I have a cesarean, I need a bowel or general surgery team present, because the minute you go into my abdomen, my anatomy is not going to be where a normal person's would be. So you need someone that's going to be a bit more specialised with that difference. Might not be exactly like mine, but if anything was to crop up or go wrong, it'd be beneficial to have the correct teams in place there and then. And I went into hospital at 32+6 with severe vomiting, and I was vomiting blood. There was a lot of blood, and I wasn't eating. And I said, I've got a bowel obstruction, and it was, no, you don't, you just got heartburn. And I said, no, I've got an obstruction. You don't vomit blood with heartburn. Well, if it's burnt your esophagus, it might be a bit irritated. I went, not this much blood. And I said, and I can't eat and I can't swallow, and everything I try and ingest is coming straight out, which tells me I've got a blockage. I was in for 4 days before they gave me an MRI, which showed I had a blockage. At that point, they still refused to deliver me because it was better for baby to stay in than be delivered because of the gestation. And I explained that I felt like I was being used as a vessel because I was just there to grow this human, and no one cared about my well-being. And I remember saying to my husband, they're going to kill me. Like, I'm going to die. Like, I felt like everything was just shutting down because I was so weak because I wasn't eating and drinking, and I didn't know how to get anybody to listen because nobody was listening. And then on the Friday morning, I went into labour, and the midwife said, when you start bleeding, then we know you've dilated because your placenta's ruptured, and then we get you to theatre.
And all
And she
that
took me
was how many weeks?
33 plus 3.
33 plus 3.
And I remember sitting down with this one doctor and saying, if I was a multiple pregnancy, you deliver at 34, 35 weeks, you wouldn't question it because it's a singleton. You're pushing me as far as you can go. And I was like, and I understand and I respect that. However, my condition is deteriorating. My baby was always measuring ahead. He was always measuring a good size. So I wasn't, it sounds selfish, I wasn't worried about him. I knew he'd be okay. My fear was that I would not be, and I'd be separated from him, or I'd have to have extra surgery, or they're going to do something really wrong. And it's like all my worst fears were like becoming reality, and I had no control over it. And no matter how much I tried to get people to listen, nobody listened.
How did you feel
So
like mentally when no one's listening to you?
terrified. Like, I've never felt fear like that. And as a human, you want to be able to control certain aspects of your life, you know. In that moment, I couldn't control anything, like anything at all. I remember just labouring this whole day and saying to my husband, it doesn't feel right, something doesn't feel right. And it got to that 8 o'clock and the night staff come on, and the midwife put me on the monitors because I hadn't been monitored since 1:30 in the afternoon. And she went, oh, she goes, you're having 4 contractions in 10 minutes. She goes, your labour's actually picking up quite a bit. I said, I know. I've been saying that all day. I went, but no one believed me. And then she's like, right, I'm going to alert the doctors because obviously if you do dilate, that's going to be very serious very quickly, and we can't risk that. While we're waiting for the doctors, because it's night time now, so it's only the on-call team available, my contractions went from 4 in 10 to 6 in 10, but something was stopping my body dilating, and I've got to have someone looking out for me up there, probably my mum, because something was on my side to stop me dilating. But no one really bothered doctors-wise until baby started having D cells, and he was having D cells to like 40, 50 and struggling to recover from like 140, 150.
Sorry, would you be able to explain the D cells so then people
So
can
it's
understand?
where the baby's, so when you're on the monitors, it's where baby's heart rate is dropping to like dangerously low levels, and it's struggling to get back up to where it should be.
Where should it
So
be?
between 140 to 160 is considered normal with a labouring patient as well. So when he was dropping to between 40, 50, 60,
Wow.
and he wasn't coming back up from that, it was, no, the doctors need to come in here now. I met the doctors at around 3 a.m. and I'd already had the steroid injections 2 days prior to strengthen baby's lungs in case he was delivered early. So that was already done and in place. And I met the doctors. I remember being given this piece of paper to sign, and I was totally out of it. And when you're in that situation, when you're in pain and you're scared and your body's in fight or flight, nobody reads the small print on what them consent forms actually say. You just sign it because you
Yeah,
need
I
to
did
sign
that
it.
as well with
Sign
Bella.
it. Yeah. And have you ever looked at it to this day about what it actually says? I never knew what it actually said until I had my second and actually read the consent form. And it's actually interesting what they put in there because that had a knock-on effect for what happened later on. But yeah, I got took to theatre and they couldn't cannulate me, which I warned them I was difficult to cannulate, but you know, took them an hour to get me a cannula in and then do my spinal. Got me laid down, and I remember the midwife saying to me, can you hear that noise? I said, yeah. She was actually a baby crying outside the room. I went, oh, has it been delivered? What is it, boy, girl, what? I looked at my husband and I went, why wasn't it crying before? My husband said it was purple. That baby was purple when it was born and carried straight out the room. Well, why wasn't the warmer in the room? You know, when you watch TV or like see people post online and their babies are lifted up and they see them and they're in the same room and everything is there. And I was baffled. Then my husband was called out to find out the gender. He came back in and told me, which I'm still fuming about to this day, put my life on the line and he found out what it was before I did. Came back in, told me, he went out, he trimmed the cord down. Then they brought Kian in, wrapped up in a towel to meet me. At that point, he was around 7 minutes old. So by then, about 12 people had met my son before I did. In the background, I heard someone say something doesn't smell right. And then they poked their head over and said, oh, we've nicked your bowel and the contents of your bowel is leaking into your abdomen. And I said, well, where's the bowel surgeons? Because they should have been here. Oh, they've not got here yet. We've paged them now to come. I remember saying nobody should have cut into me until the team were in place. And what annoyed me more is I'd been labouring all day. So they had the entire day when everyone was present in the hospital to put that team together and speak to one another, and nobody did.
You must be fuming. They didn't even listen to you like the whole day. Like they could have done something. They could have, but they didn't.
So obviously, I think Ian for 1 minute and 19 seconds on the Saturday morning, the 19th of March, I was put on a general anaesthetic. I then woke up in recovery, was taken straight to intensive care. All I wanted was to see my baby, and there was an envelope on my table with pictures of him inside. And at that point, he had like a CPAP mask on and whatever. So I opened this envelope and I seen these pictures. I was like, what's that on his face? Like, no one was there to explain anything to me. And then I remember my husband coming and bringing me my stuff. And then my dad visited, and I was like, I just want to go and see the baby. Why am I not allowed? They're like, oh, you're too weak, you're too fragile, you're this, you're that. And I was like, that's not my fault. Why am I being punished? Sunday rolled around. I was like, am I going to see my baby today? Maybe later.
Can
Maybe
they not
later.
push you there?
Then there was a case of COVID in intensive care. So a relative of someone had come to visit somebody in the bed next to me had brought COVID into the bay, and he had tested positive. So I was tested negative. Now I was double vaxxed and I'd had COVID in pregnancy as well. So in theory, baby was covered as much as humanly possible, aside from being vaccinated himself. And I was just, at the end of the day, I'm expressing breast milk. That's all I can do. And even that maternity never visited me in them 48 hours after birth. My intensive care nurse went and got me a breast pump because I could feel my milk was coming in and taught me how to use it, because I was like, if I don't get it out, I'm going to dry up. And I'd wanted to breastfeed. So I was like, the only thing I can do is the only part of my body that is working is my milk supply right now. So I want to do as much as I can. So my husband was coming and collecting my milk, and they were taking it over to the NICU. And then on the Monday, I was very hormonal, very angry. And I basically said, if you don't take me to see my son, I will rip out every cannula and every line, and I will make my own way there. Because at that point, I was like, this is inhumane. You cannot physically stop me seeing my child. I've done nothing wrong. You have done something wrong. I am paying the price for them mistakes. What is happening? Like, it's not right. Do you know what I mean? And my poor husband, he was having to deal with everything on his own, which is nothing for any first-time dad. You should never have to do that on your own and have to choose between being with your critically ill wife and your premature baby. You know, no human should ever have to go through that, let alone a first-time dad. And obviously that time, because it was 2 years post-COVID, nobody could actually visit the NICU other than parents. So he couldn't even have his own family come in and visit as a support system for him. He was on his own entirely. So one of the nurses had rang the NICU and was like, we're going to bring mum over. They put me in a wheelchair. They took me over. I was allowed 10 minutes and I wasn't allowed to touch him. I wasn't allowed to put my hand in the incubator. I wasn't allowed to do anything. In case I had COVID, I said, I'll glove up, I'll mask up the lot. No, you're not allowed. Was that great? So I seen him for 10 minutes, went back to my room, cried literally the rest of the afternoon. That night, I got a phone call from my husband to say that his lungs aren't functioning and they want to give him something called surfactant, which is a chemical. It's a chemical that they give to babies to help the elasticity of the lungs. So when he's breathing with the CPAP or on like low flow, his lungs aren't expanding properly. So it's to help his lungs to stretch and be able to expand enough to get his own oxygen levels up. But to give that, he has to be sedated, and it's given then they're put on a ventilator to push the airflow and stretch the lungs out as best they can. And obviously, I have a lung condition due to long-term ventilation. So I have a condition called bronchopulmonary dysplasia, which means my lungs only function at 40%. And that is due to long-term being ventilated.
And you were
as a
like
baby.
6 months?
Yeah. And I wasn't diagnosed with that till I was 27 years old. So all of my issues have become apparent as I got older. And as my consultant, I'm under a respiratory consultant, and he said, this is what happens when babies who would have usually died are given intervention and kept alive. Nobody knows the long term of all of that. Because and back then we do everything in the moment to help the baby, but we don't know because there's not enough research to know in 10, 15, 20 years time how that ventilation can damage or could cause damage. So because my lungs work at 40%, I am treated the same way as a COPD patient. So I've got chronic lung disease, so therefore I have inhalers for the rest of my life. It also means that my resting heart rate is 100 beats per minute. No matter how fit I am, it will never be between 60 and 80, which is what an average person would be. So when I have surgery or things go wrong, my heart rate naturally will spike to 130, 140, which would for a normal healthy person be dangerously high. For me, it's high, but for it to be dangerous, it then has to peak to 150, 160. So that's why I always whenever I have surgery, I end up in intensive care because my heart and lungs are that severe. So when I was told my baby's gone on a ventilator, I thought, oh my God, he's going to end up with the same lung condition as me. This is all my fault. And it is that
guilt.
blame because I couldn't advocate for myself enough to make them believe me. And I remember the call with my husband and he was upset. And I said, I need to get there. And it was only 3 doors down from where I was in intensive care. And he's like, they won't let me collect you. I've already tried. And intensive care is one-to-one nursing. My nurse had been taken to another person so they could go on a dinner break. It's about 1 o'clock in the morning. And I said, I need to go and be with my husband and be with my son. Please, can you take me? She's like, no. She's like, you take me, I'm taking myself. And she eventually came and she wheeled me down. And I seen him before they did it. And then I waited outside with my husband, and then we went in together and we seen him ventilated and everything else, which if you've never seen it, it's not a nice thing to see a baby in a medically induced coma or anything like that. And it was just not what we expected, and they don't prepare you for it either. And then I got took to my bed, and it was just a waiting game. The following morning, get a phone call from my husband because he then stayed all night with him, and he said they've weaned him off the vent. His lungs seem to be working. They're repeating the X-rays. We'll have the results soon. The X-ray showed he had a better expansion of the lungs, so that's great. Put him back on CPAP. The issue with that is the hospital he was born in was only a level 2 NICU. So they take babies from 32 weeks and they have a policy where they can only be on CPAP or breathing apparatus for 48 hours. Yeah. He then needed moving to another hospital. The only hospital they could get him into, so we're here in Leicester. Our closest NICU to support his need was full. They needed to move him 2 hours away to Mansfield, which is near Chesterfield, beginning to go up north.
How far is that from you?
2 hours. And I know babies get moved all the time, but I wasn't moving with him. And I wasn't allowed because I was so critical. At this point, we knew my bowel wasn't functioning at all. My bowel had totally shut down. So it was a waiting game for me because I needed tube feeding. Well, they wanted to tube feed me, but in the end, they did something called a TPN, which is intravenous feed through your vein, and it runs for 24 hours of the day. And it is one bag after it. Bella would have had one.
Bella had those.
Bella would have had it. It's really, really common because if you can't feed and your bowel doesn't work, it's a way to give your bowel rest to recover with getting all the nutrients that you need to keep alive. So, and at this point, I'd gone through 50 cannulas as well. So they'd put a midline in one arm to give me a constant flow of like all my medication. And then I had my TPN in the other arm. So I was like that. And then expressing milk. And then to be told my baby's being moved away. And obviously at this point, I'd still never held him. I'd never touched him. I'd never been allowed. And he was like 3 days old and he was going. So it was 4 days old because it was a Tuesday. And I remember saying, I'm going down to the NICU, and I had this really good nurse this one day. And she was like, the baby isn't being moved until mum's been able to hold him. The doctor went, well, she's not allowed. And the nurse was like, well, she's the mum. She can do whatever she wants. You've got no right to tell her she's not allowed. And she come over and she picked him up. She goes, what arm do you want him on, your left or your right? Because obviously you've got wires and stuff. And I was like, well, I don't care. I just want to hold him. So she was like, all right, well, we'll put him this side. If you're not comfortable because of this wire, we'll move him or we can hold him that way, whatever you're comfortable with. And she was, and just hold him until your pain comes in or whatever. She'll just make the most of it. And I remember holding him and being like, to my husband, like, he's still not got a name. We need to kind of name him. Like, he can't move and not be named. He was really stressing me out. And I remember I wanted Kai and he wanted Kian. And we couldn't decide. And I was like, okay. So I was holding him and he was on this arm, I'll never forget. And he was like fast asleep. And I was like, right, I'm going to say 2 names to you and you have to blink or flutter your eyes at the name that you like. I said Kai and he was totally still. And I said Kian and his eyes fluttered. And my husband went, that's it, he chose his own name. I was like, no, let's do best out of 3. And at all 3 attempts, he picked his own name. I was like, great. You've won on that one then. I'll go through all this and you get to pick the name you want. And then I said to the nurse, because I noticed his monitors, his sats and his observations and everything, so his oxygen and his SpO2, so everything, his heart rate, were the best they'd been the minute he was in my arms. And my husband hadn't been allowed to hold him either for some reason. He was allowed to touch him, but he wasn't allowed to hold him. So he'd have no skin to skin, no physical contact from family since the day he'd been born. Right. So I said, this proves he should have been getting held because he needed that physical touch and that contact. And can that not stop him being moved? It's already been approved and the cot's already been reallocated. I was like, right. And then I went back to my room because obviously with intensive care, your observations are done every 20 to 30 minutes or sometimes more, depending on your case. And obviously I had all my wireless machines with me, but they needed to get me back and get me fully monitored. And then I got a phone call later on to say, the transport team are with him. Do you want to basically bring mum down to say bye? So I went down and they were like, oh, he's not holding still for some of the tests that we need to do. And it was like monitoring his heart and whatever and all that to check he was suitable for transfer. Can you hold him while we do the scans to keep him calm? I went, yeah, all right then. Did that. And then, oh, we're done with you now. You can go back. I went, that's rude. And my nurse, she was like, no, mum is staying until he is now moved. It's not fair. You can't treat her like that. And then she wheeled me down to that when he went with the incubator, the transport incubator, which if you've ever seen one of them, it's like watching something from the future. It's obviously you have your normal incubator, but then next to it is all the machines and the monitors and the medications and whatever next to it. And in that transport incubator, your baby's strapped down, their head, their arms, their legs. So obviously it's at rocks, they don't tip or anything with them. So I followed him down to the transport ambulance and then I rang my husband and said they're moving him now and he was going to then meet him there. which he did. And then he FaceTimed me and he showed me I really resent him for this a little bit, but he meant well. He showed me an empty incubator. I went, oh my God, what's happened? He goes, no, nothing's happened. He goes, look, he goes, I'm allowed to hold him.
Oh.
And he was in his arms, but he'd like, he had no, at that point, he had no CPAP on. He was just on nasal oxygen. There was like, he got them, he didn't actually need it. They were trying him off it for a bit. I was like, what the hell? He's been moved because of his breathing. And they've put him straight onto nasal oxygen anyway. Kian was away at the other hospital until Mother's Day. So he left on the Tuesday, he got back on the Sunday. And I was allowed to spend 4 days visiting him. So my husband would come to the ward, pick me up in the wheelchair, wheel me down to the NICU. Whilst Kian was away at the other hospital, my husband was taught how to NG feed him, change his nappies, change his clothes. He was really supported in being that hands-on dad. So he helped me with getting more involved once Kian returned, because I was terrified. I didn't know what I was doing. But it also gave me faith when we found out Kian was going home, that I knew my husband would cope because I wasn't going home with him. Because my bowel had shut down for, at this point, 3 weeks, it hadn't functioned for. The blockage that I'd had in pregnancy had just sat and wasted away and had become necrotic. So I knew the day before Kian was going home, I'd have to have more surgery. I went to theatre for 7 hours and had 30 centimetres of necrotic bowel removed. And it was like Groundhog Day, because I went straight back into intensive care with the same nurses that had looked after me 2 weeks prior. And then on the Saturday, my husband brought Kian into intensive care to say goodbye, and he took him home with my mother-in-law. And that was the hardest thing, even harder than having to say bye when he moved hospitals, because I didn't know. But there was a few things that were hard that week. The Thursday, because I knew I was having surgery on the Friday, so on the Thursday, I'd arranged for my dad to be able to visit Kian for the first time, because I didn't want my dad to meet him without me, because that didn't seem right. But he wasn't allowed on the neonatal unit. He had to meet him outside of the unit in a corridor. Even though my mother-in-law, because she was going home with my husband and Kian, she was allowed in the unit, but my dad wasn't.
Oh, no.
So I arranged for my dad to meet Kian. So I was able to get at least one thing that was just for me, that made me feel like a normal mum, that I could show my baby off to someone. So I got that. And then Thursday night at about 2 a.m, my husband took me into Friday morning. My husband took me back to the ward and I had to say bye to him, not knowing if I'd survive the surgery in the morning, which was awful. And I remember waking up in recovery on the Friday and being like, oh my God, I'm alive. That's the first thing. I was like, okay, I've survived this. So that means I'll get to see my child again, you know. And then on the Saturday, then obviously he went home. And I didn't know how long I'd be in for, if my bowel was ever going to function again, or I didn't know anything. And then me and my husband spoke, because obviously at this point Kian was 2 weeks, but he was only 35 weeks gestation, and he was only £4, 8 ounces. So he was born at £5.2. Obviously they always lose a little bit of weight anyway. And he dropped to 4.4 and he was now 4.8. So I said, you know what? Don't bring him to the hospital for visiting. I need to do what's the greater good here. If he picks something up in the hospital, that's on us for exposing him. So I just took it on the chin. I was like, I'll be okay. I'd rather him be at home and be safe and be well. So we used to FaceTime all day. We'd be on FaceTime to one another. But it was so hard, like hearing him crying and not know why he was crying and not be able to fix it. And obviously, you know, as a breastfeeding mother, when you hear your baby crying, your boobs leak. So every time I was on the phone, my t-shirts were getting soaked and I was like, I don't know what to do. And I was still expressing and everything else. And it was just, it was so hard in so many different ways. And I eventually did get home. I'd been away for 12 days and I eventually got home. At that point, I'd been in for nearly a month in hospital. But I went home with 26 stitches from my rib cage all the way down to my C-section scar where they'd done the open bowel surgery. So because of that, I still had nurses coming to do my cares every 2 days for my dressings and eventually remove my stitches. So I had to literally be babysat whilst babysitting my baby. So I couldn't be left alone with him because I couldn't carry him and I couldn't pick him up and I couldn't get myself up and down the stairs, let alone carry a baby up and down the stairs. So as a parent, every maternal instinct was, I was up against the barrier. I didn't know how to just be a mum, because I didn't know how, I couldn't. Do you know what I mean? Like, my body was weak, so I couldn't meet his needs. So everyone, like, if I wanted to feed him a bottle, they had to pass him to me.
Oh, no.
I mean, I suppose it was a good motivation to get up and going, but when you have to ask someone to help you just lift your own child when they're crying, it's a bit undermining and patronising in your position as a parent. And again, I was so angry because none of this was my fault, and I knew it wasn't my fault. And I just had to focus on getting better. And I got to like the 6 weeks post surgery point, and we started going out for walks with a pushchair, and I wanted to go to baby groups.
Wow,
That's what
you're
mums do,
brave.
isn't it?
Yeah.
And I went to this baby group, and I was like, everyone's had these perfect pregnancies and perfect deliveries, and they all got to see their baby straight away and get skin to skin and take them home. And it was all just another reminder of what I missed out on and what I didn't get. And I remember my health visitor saying, "Have you been offered any mental health support?" And I was like, "No." And I went to my 6 week check with a GP, as you do with babies, and I explained about what I'd been through. He goes, "I don't think you've got PTSD, you've just got a bit of trauma."
Wow.
And,
Really?
okay. And I didn't know where to go from there, because if I'm saying you go to your GP, you get a referral, and that's how you start your process. And I thought, okay, so if you don't believe me, where do I go for help? And I didn't know, and that was hard. And then I contacted PALS, which is the patient liaison service within the hospital, which is where you go to make a complaint about your care. And I'd written everything down of what had happened, and I had messages between me and family whilst I'd been an inpatient, before Keane was born, after he was born. So everyone knew everything, and it was good, because even though I was high as a kite on medication, it was like a diary that I'd not even remembered writing, so to say. And I contacted PALS, and I wrote a 10-page complaint about everything from my pregnancy to being in labour, to the delivery, to the aftercare, everything. Being separated from Kian, the risk of, not getting skin to skin, not getting kangaroo care, how that can affect him, me, the bond, everything. The result was, well, you signed a consent form for the cesarean.
Dude, that's the consent. Oh my God, the consent form.
Yeah. Did you know the consent form states that you may have injury to other organs? You
No.
may be separated from your child if you need to have extra surgery and go to another ward. You may die, funnily enough. It's got all these lists on there of all the risks, and I didn't know this until actually I had my second child, and I read through the consent form in full, that I ticked every single risk other than death. Everything that could possibly be ticked on that risk form, I had in my first delivery. And I remember saying to the lady from PALS, but I never actually read it. She goes, "Well, that's your fault." I went, "Yeah, but it's not though, is it?" It's not, because we knew from day dot I'd have to have a cesarean delivery. So that, at the point I was admitted, they should have come and gone through that with me at the point that I was calm and in a good headspace, not wait until it's an emergency situation and make me literally sign my life away, which is in effect what you're doing. But the be all and end all was I could not go down any legal route with the hospital whatsoever. So, and I never wanted a payout. I wanted acknowledgement that something had gone wrong somewhere, and that if I was to have another pregnancy, things would go better the next time. I wanted just a bit of a guarantee that I'd be looked after better and I'd be listened to. Around the time I found out it couldn't go any further, I found out I was expecting my second. So Kean was a year old. We had his first birthday. We went to see a Snoop Dogg concert. We went out to Mallorca. And whilst we were in Mallorca, I did not come on my period as I was due. I'd ordered tests to arrive on Amazon Prime for the night we got back, and I tested at 1 a.m. At this point, I was a week late, and boom, 2 lines. And actually, I think I
Was it
messaged you
joy
and
or is it
told you.
fear?
It was fear, and it was a mixture. But I remember I messaged you and told you, and I remember telling a few other people, and I was like, I don't know what to do with this, like, because I'd made that little community of parents that understood what it was like to be a NICU parent or go through birth trauma. Like, there was more support online than there was in person for all of that. I remember telling my husband and being absolutely terrified. And I rang pals the following day and I said, look, I know we can't go any further with the complaint, but all I wanted was support for a further pregnancy. I'm now in that position. So what can we do? And she goes, was there at least one consultant you got on with? I said, yes. She goes, who was it? And I told her. She goes, okay, because you're going to meet her in the next 2-3 weeks. And you're going to have a sit down. Even though you've not had your booking appointment with your midwife yet, she goes, we're going to sit down and start making a plan from now. I said, okay. Instantly felt relief because I thought, okay, this has got to go good, right? So I met this consultant at 7 weeks. The first thing she did was apologise for everything that I'd been through. And she weren't even on that night. She wasn't even in charge of any of my care or what went wrong. But she took the time to read my notes before I'd gone into that appointment, and she knew what I'd experienced. And she straight away said there was no reason for you and Kian to be separated. She was, they could have bent the rules a little bit and let him stay in that hospital for the fact that we had made you as unwell as what we'd made you. And she goes, so this will not be happening again. And I was like, okay. She goes, you will never be forced to go full term. She goes, you will not be patronised. She goes, the minute you say you've got a blockage in this pregnancy, she goes, we get you in, we look at you, we assess you, you get delivered if it is that bad. She goes, no matter what gestation you are, she goes, we put things in place for an earlier delivery, a mid-term delivery, a late term, whatever. She goes, whatever you need, we will have a plan in place. And she goes, I'm friends with a really good bowel surgeon. She goes, she's going to be on the team. I've already told her about your case. We'll get her in for one of your next lot of appointments. I was like, oh my God, I've walked away from that appointment after an hour and a half feeling the most relief I have ever felt. I looked at my husband and said, why did things have to go so wrong for things to now be put in place? And I get it, everyone learns from their mistakes, but the mistakes that I was subjected to should have never gone as far as what they did. I seen that consultant at 7 weeks, 13, 16, 19, 24, 28, 31, 33, and she delivered me at 35. Wow. And I only seen that one consultant. And she wrote all over my notes, if I ever go into MAU, they have to ring her. I am not to be dealt with by any other doctor or consultant or anybody that could risk my health and well-being by having an opinion on how to deal with me. She goes, the thing we need for me is consistency with my care. Yeah. And that's one thing I didn't get the first time. And obviously the bowel surgeon met her at 13, 16, 25, 31 weeks, because at 27 weeks I had an MRI to look at the positioning of my bowel to make sure that we knew in delivery where my bowel was. So with Kian, had they checked the MRI I had 2 days before he was born, they'd have seen they should not have cut where they cut. They didn't check it. It's actually in my notes that they cut in the wrong position. So this time they made sure they checked the position of the whole of my bowel in relation to baby, so that when they did that incision, they knew that there was no risk or as minimal a risk as possible. We decided from the get-go I wasn't going to go beyond 35 weeks. 34 was my aim. We got to 35. But my consultant said at 33 when I seen her that I didn't look well. And I said, I'm okay. Do you know, I feel all right at the minute. She goes, well, I'm on a course in London, but if you need me, I'll be back here within 2 hours. And on my way back, I will ring the team so that by the time I walk in, you are in theatre and you are ready for me to start that surgery. And I thought, you know what, this is the most, you've never walked into an appointment and walked out being happy to be butchered. But that's how I felt. I felt like if anyone's going to cut into me, it's going to be this lady because she knows what she's doing. And she put me under the mental health team. So I was under an extraordinary team of mental health support who was so validating. And I had one who spoke through Kian's experience and what I went through. And I had one that helped me deal with the control factor of, this is what we're not doing a birth plan, we're doing a preference. And these are the different outcomes that you may have. So if it was this outcome, how would you want it to look? If it's this outcome, how would you want that to look? And it gave me that bit of control back in some way, that if everything was to go pear-shaped, I could still get that skin to skin. I could still be told when my baby's going to be born, you know. And that the lady that I did that preference with, she was in Luca's delivery as well. So she was sat by my side, talking, doing all the hypnobirthing breathing when I was getting a bit anxious and calming me down. And she stayed with me in recovery. She gave Luca his first bottle feed. She got him dressed. She put his nappy on him. She did everything.
Oh.
She's like, do you mind if I do this? I was like, no, not at all. I was like, I can't do it, so feel free. And she was also the one that raised the alarm when Luca started grunting. So with C-section babies in general, with vaginal babies, all of the fluid that they've sat in for all that time gets kind of squeezed out through the birth canal. With C-section babies, obviously a bit earlier anyway, you're going to have a bit of an issue with breathing sometimes, but you can get full-term babies that go to the NICU just to be suctioned and have that bit of support because they get a lot of gunk and fluid build up in their throat. So Luca's breathing was a bit crackly and raspy, I'd say. And he grunted and you could hear it. He wasn't necessarily struggling, but you could hear there was something there. A bit like when a baby's a bit congested and got a bit of a cold. And I noticed it when he was delivered and he was put on me and I got my skin to skin. And they said, give him that time with you. There was like, you need this bonding time with him. Because if he does have to go to the NICU, we don't want to rob you of this period. I was so happy that they appreciated that and gave me that. But it continued, and I said to the midwife, I was like, I'm not entirely happy. Can we give NICU a call and just get them to come and check him? And they sent 2 junior doctors down who were quite dismissive and said, no, there's nothing wrong with him. But it continued, and then a senior one come down and was like, no, he needs a bit of CPAP, he needs a bit of support. But because I delivered at a level 3, so Kian was born at level 2, so it's 32 weeks onwards, but they have limited breathing support and timeframes. Because we never knew what gestation Luca was going to be delivered at, we chose the level 3 just in case it was that bit earlier to keep us together and to have that support, that better support ready. So he come up to the NICU. My husband went with him. I stayed in recovery. On the postnatal ward, I got a side room, which my consultant and the perinatal mental health team had arranged because with my PTSD and trauma, they didn't want me on a bay with babies when I'm not with my own baby. Because I've already been subjected to something similar once before. They didn't want to re-traumatise me, which I really appreciated. They'd also arranged for, because I was in a side room, my husband could be in the room and stay overnight if he wanted to. This was before men could stay overnight. And because it was a side room, they said if I needed that security blanket, he could also stay. Yeah, so he came down about 9 o'clock and he came and checked in with me, gave me an update about Luca. And at that point, they were weaning him off the CPAP. And if he could maintain himself on room air, then he could come down and be on the ward with me. And he did, but he couldn't maintain his oxygen. Not his oxygen, his temperature. His temperature was dropping. So they moved him from intensive care, so the NICU, so like the more severe, to like the special care, so just the nursery where it's just like growth, feeding, temperature control, all that. So they moved him to that side. And I said to my husband, look, I'll get myself up and moving tonight. You go be with him. Come and pick me up in the morning after I've had my breakfast and we'll go down together. That gives me the night to get up and moving and get my legs working and get walking and go for a wee and all of that. Me being me, nothing's ever straightforward. I couldn't go for a wee. I ended up with a UTI. So I was like, that's just my luck, isn't it? But I got discharged. I had him on the Friday, got discharged on the Monday.
Okay.
And then it was just a thing of him grabbing and feeding. And they put an NG feed in, which I was quite against because you have more criteria when you have to be tube fed as a baby. So I obviously wanted to bottle or breastfeed, but to get the NG out, you have to have 24 hours of just bottle feeds and no NG. My unit was literally putting like 1 mil down an NG feed, which would then reset my whole 24 hours, which was really frustrating because I had Kian at home, he was 18 months old and doesn't understand what is actually going on. So we were splitting ourselves between Kian, who was at my in-laws, and then Luca, who was in the NICU, and me recovering from a C-section. And like I said, it gave me the motivation to get moving and going, but it wasn't the ideal. And actually, when it was me and my husband doing the feeds, he could take a whole bottle. When it was certain staff nurses, they'd do a whole NG feed and not even attempt a bottle. So it was a constant battle. Got to the weekend, so at this point Luca's a week old. The nurses had checked the charts, the height, the matrons, and there was like, we can see when you and Dad are here, he's feeding fine. We'll took the NG out. Give us the weekend of just bottle feed, you can go home. Got him home on the Sunday, which was actually Diwali day. So I drove by my grandma's house on the way home so she could meet him because she's like 80 odd. I said, we're not getting him out, we're not doing anything. I went, but you can come and have a look at him. And he was smaller. He weighed £4.8 when he was born.
Oh, is it?
And he dropped to around £4 because obviously they always lose a little
Yeah,
bit.
yeah, yeah.
So he was that big. He was diddy. Got him home, and I'd said to everybody. So my dad had visited at the hospital, my brother had visited, and my in-laws had visited. So honestly, when we got home, no one would visit, which sounds really bad. But I didn't get that newborn bubble the first time. I wanted to just have a bit of time of just us as a family, and we got that, and I really appreciated that. And other than having a nasty UTI, everything was smooth, everything was calm. Luca was feeding and growing, and he latched on the breast for the first time within an hour of being at home.
Oh.
Whereas he wouldn't latch in the hospital. And I thought, I'm stressed, I'm anxious, we've got a lot going on. I'll wait till I get home. I've got milk, I'm not worried. Literally sat at home, put my feet up, had a cuppa, and he latched, and I was like, this is what we needed. We needed this calm and this relaxing. Everything went smooth with Luca's pregnancy. It was the most redemptive experience ever. And I have nothing but positives to say about my medical team that were involved. So, in the months after Luca was born, I started having issues with my bowel. And obviously, as far as I knew, my bowel was in good condition at his time of birth. And it was. Bowel surgeon was there. She was happy. They believe the UTI that took 3 months to clear had caused my bladder to swell and become inflamed. So my previous bowel surgery, where they took the healthy bits of bowel and rejoined them, had become stuck on my bladder because obviously the inflammation. And over the space of 9 months, that section of bowel had grown from the size of a 5p coin to basically the size of a Coke can.
Whoa.
So it was 3 to 4 centimeters by 10 centimeters in its growth, and it was holding 500 mils of fluid at any one time.
Oh my God.
And in this time period of my bowel deteriorating, I'd also lost, by the time I'd had my surgery in November, I'd lost 14 kilos in weight.
Oh
So
my
I was 56 kilos in May of 2024, and by November of 2024, I weighed 42.
Wow.
I had a big, massive surgery, and I was very lucky.
So that's
because I
your
was
third
able to
surgery, right?
Yeah. So fourth. So I'd had cesarean
Oh.
with a bowel repair in that cesarean, then a bowel surgery, then another cesarean to have Lucas. This was my fourth surgery in just under 2 years. But I was lucky enough to have the bowel surgeon that I'd met in Luca's pregnancy and built that rapport with, who had already been inside my abdomen in the November of the year before to deliver Luca. So she knew vaguely what she was going into, and I trusted her because I already knew her. So it gave me that faith, it gave me that consistency of care, which I've been craving for all that time. So I had an 8.5 hour surgery. And during that time, they realised that my bowel, which was malrotated, so everything was wrong from when I was a baby, was actually a lot more wrong than they expected it to ever be. So with a normal person, you have your small bowel in the middle, your large bowel loops around the outside and goes down to your colon and your rectum. I had bowel up here, I had bowel down the bottom. My appendix, which is meant to be on your right side, mine was up here on my left. My liver had bowel wrapped around it, and obviously there was this chunk of bowel sat on my bladder. So in this surgery, she literally took all of my abdominal organs out and repositioned them into a new position to hopefully help everything function better. What she did not do was remove any section of bowel. The idea was when the bowel's in the correct place, it should hopefully shrink back because obviously your bowel is a muscle. So it should hopefully shrink back down. It did not. So from November to March, I then lost another 5 kilos in weight.
No.
At the point I went for surgery in March, I seen her on the 17th of March, told her what was going on. I'd had an MRI as well about a week prior, so she pulled the results up for that. And she just looked, going, it's got to go. We gave it time. It needs to go. It's not gone down. If anything, it's gone worse. I think we need to just get it out.
Yeah,
Like,
what, out the whole bowel?
There was so 2 days later, get a phone call. You've been booked for emergency surgery on the 31st of March. So I seen her on the 17th. on the 19th, which was Kian's 3rd birthday, so my
Uh-huh.
most triggering day for everything, my starting point of everything going wrong, get this phone call to say you've been booked for 2 weeks' time. I was like, okay, let's just do it. Clearly, it needs to be done. Went to theatre. I'm pretty used to surgery at this point. So this is my 6th
Yeah.
surgery. Yeah, 5th or 6th surgery, and I wake up in intensive care. And I remember asking for pictures of what they'd removed because I was like, I'm really intrigued of what's been giving me all these issues. And I remember waking up with my head flopping to this one side and seeing my surgeon and being like, so what was it then? And she goes, it had gone worse. And I was like, right, how much worse? And she's like, well, what was originally 10/3 was now 30/10. I thought, what do you mean? She's like, yeah. She goes, it was originally like 3 centimeters, like dilation by 10 centimeters wide, like all stretched out. She said it was now 10 centimeters dilation. It's what cervix is of getting a baby out. So it was 10 centimeters wide by that 30 centimeters stretched out. And she goes,
What?
it was never going to recover. And I was like, do you know what caused it? And she goes, it was just, you'd been left for too long. In that initial kink and everything going wrong, it'd just been left for too long.
So what they're doing then?
Pardon?
So what they're gonna do?
So they just cut it all out. So I do still have bowel left. I did not have to have a bag because the bowel itself has lots of little creases in.
Uh-huh.
And obviously, as we all know, and it just stretches, like as you're eating, it all moves around. So that the section they removed was a stretched out piece of bowel. So they were able to remove that and me still have enough left to not need a stoma.
Okay.
Luckily, very luckily. But she is very confident in her work. So I was in theatre for about 5-6 hours and she was happy, but she did say, look, we'll take the recovery slower this time. We'll build you up gradually with your food intake because whilst you have to put weight on, you can't put weight on too quickly because of how much weight I'd lost. So here's me, 37 kilos, going home, gradually eating, gradually drinking, all that. 4 months post-surgery, find out I'm pregnant.
No.
And I'm
Wow.
not going to lie to you, with how weak I'd been and how much weight I'd lost, I did not think, because my periods had been a bit sketchy, which happens with severe weight loss, I didn't think I'd be able to get pregnant because who thinks after all that, their body is ever going to want to be able to conceive a child? Yeah, so I found out I was expecting and I was in a state of shock. So I contacted my midwife, I still got her number. And I was like, yo, mate, I've just done a test and it's positive. And she was like, okay, I'll email everyone I need to email now. I was like, banging. By the time I'd seen my midwife for 8 weeks, my obstetrician from my second pregnancy was already in the know that I was expecting. My bowel surgeon had already been made aware. The mental health team had already had a referral made to them. Like everybody by that point was aware that this is what was going down. This is what my last year and a half, 2 years has looked like. And this is what we need to do. So a whole plan was already in place by the time I'd had my 12, 13-week scan with the NHS. Like the organisation behind closed doors was so thorough that I knew that I'd be so well looked after. And I was expecting so much judgment or patronisation of, oh my God, why have you got pregnant again so quick or this or that? And I'll say to anybody, do you know what? I didn't plan it. I can't take hormonal contraception because it doesn't absorb properly into my bowel.
Oh.
And because my periods were so sketchy anyway, but I've been on hormonal contraception previously, it made me constantly bleed. So at a time when my body is so erratic and trying to get hold of itself and give itself a factory reset and put weight on and juggle 2 toddlers in the background and work, the last thing I wanted to do was pump myself more of all the hormones and other stuff that can then have an adverse effect. So very surprised at the pregnancy, under a very good medical team. I am now 26 plus 4. I have been seen by my obstetrician 3 times up to this point, and I've got my next 2 appointments booked in with her. I know when I'm seeing my bowel surgeon. I see the mental health team last week. I see them next week, and I see them 2 weeks after that. Everything is in place for every eventuality at this point. I know I'm delivering around 32 to 33 weeks. However, if my bowel copes, they could try and push me a bit further. But it's at my discretion. If I rocked up into MAU tomorrow at 26+5 and said, I've got a bowel obstruction, my team is a bit like the Avengers and they know to assemble themselves and get where they need to be and get me the MRI ASAP, look at what's going on. And if I need delivering, I get delivered within 48 hours.
Wow, it shows such a difference with better care. And
Yeah,
like it's such an amazing, like incredible story. It's unimaginable. But thank you, Elle,
no
for sharing
problem.
your story. And I
No
just
problem
want to
at
thank you
all.
for being so honest. And
No problem.
so that if there's anyone listening and then actually going through, what advice would you give them?
Nobody is going to be your advocate but yourself. And you can't always rely on your partners to stick up for you because this is new to them as well. And they don't know your body. You are your best judge of your own person as how your body copes with things. So have your own back, stand up for yourself, write everything down, names, dates, times, who you've spoken to. Because I had a catalogue of all my failings. And when I went into my second pregnancy, I could say, this is how it all went wrong. And I was able to present that and have that ready and saying, we did things your way the first time, now we're doing things my way to hopefully get things done better. And actually, when I was listened to, it showed everything went correct. And it shows the power of your own voice and having that consistency of care. And just don't give up. Don't give up at all. As hard as it may be, keep going and keep fighting. And one thing a lot of people say to me is like, how do you do it? And I was like, I don't know, but something in me I've been fighting since the day I was born. And it's that fight that I've got, and it's the fight that I've continued to have. Even when I've been failed multiple times, I always try and look to the positives on everything. And I think, and people will say, how do you even have another pregnancy after being let down? And I'm like, because I love my children, and actually I'm a good mom. And there's as much as I've been failed, they aren't my faults. They are what other people need to learn from. And when your doctor say to you, do you mind if a student's present? I'm like, no, because they need to learn. And the best place for them to learn is with a person like me, where if anything's going to go wrong, it's going to go wrong with me. And it's good for people to learn from cases like me. So
You're
yeah.
incredible. You are incredible.
Yeah.
You've been a fighter since the very second that you were born, and you are just incredible. And you
Thank you.
shouldn't have to do this on your own. And yeah, if anyone's going through this, you have to be your own advocate. And as a new mum, going through everything at the same time, it's really unfair on you. So if anyone's listening, if you're going through this, don't stop asking questions. Don't stop pushing for better care. The more we talk about this, the more we push for a change. So thank you so much, Elle, for being
And I will
here.
say, the NHS now have something in place called Martha's Rule. So if you feel you're not listened to, you can ask for a second opinion, and you can't be ostracised for it. And there's a lot of
Martha's
posters
Rule.
around Martha's Rule. Yeah. There's a number on a poster. A lot of NHS hospitals will now have this poster about Martha's Rule. And it's a number you can call. And if you want a second opinion, you feel you're not being listened to, it can give you a second opinion. So they will send somebody else to you or to call you or make an appointment with you to discuss things. So you have that second voice involved as well.
Thank you so much for your information. And I'm sure that you help so many mothers if they're going through the same.
I hope so. That's my aim.
Thank you so much.
Thank you so much for listening to this show. If you like this show, like what we're doing here, and you want to support us, the free way to do so is hitting the subscribe button. If you're struggling and you want to share your story, please check out the link in the description. And I will promise to do my best to create awareness for the conditions that people are suffering silently.